Hi, my name is Dr. Reed, and I'm a psychiatrist. After 9 years in private practice, I am fed up with the business of running a medical practice. I wanted to discuss the current challenges in providing mental health services in the face of the Affordable Health Care Law, increased supply of mental health providers, and an economy that continues to unwind. In my opinion, the combination of these factors make it almost impossible to profit from running a private practice without working a minimum of 80 hours a week. That is why it is absolutely necessary for providers to work together to confront the challenges that are facing us all. The Affordable Health Care Law is good in principle. However, because it significantly raises cost and reduces profits for the insurance company, that extra cost is transferred to the provider in the form of refusal to increase fee schedules, increasing the burden of completing paperwork for basic services, and refusal to cover specific mental health diagnosis and assessments. For example, the medical loss ratio in the law requires that insurance companies spend at least 80 to 85% of premium dollars on medical care and healthcare improvements rather than on administrative costs. So, no more billion-dollar bonuses, no more luxurious jet planes, and no more expensive trips to the French Riviera for insurance executives. Also, there will be no lifetime or annual dollar limits on allowed essential benefits. Therefore, the patients who constantly rotate through the ER for 3 hots and a cot will have those inpatient days covered. If the insurance company finds that the rotating visit was not medically necessary, they will simply deduct the amount they reimburse from you from your future payments. This makes you responsible for the cost of the rotating visit, and that doesn't make sense. Also, the insurance carriers are not able to exclude patients based upon pre-existing diagnosis conditions. So, many patients who live very unhealthy and dangerous lifestyles will have their insurance covered. The motorcyclist who refuses to wear a helmet, who gets into an accident and spends 2 months in the intensive care unit will now have coverage. And this seeps into the profits for the insurance companies. And finally, the law allows for coverage for dependent children, married or unmarried, up until the age of 26. That means the immature and irresponsible 22-year-old cannabis smoker who will crash his car into a pole and injure everyone but himself will have the bill paid by the insurance company. In essence, this law holds insurance companies accountable for providing coverage to many members of the community that they previously avoided simply because it would cut into their profits. Now, this is how it affects you. First, the increased cost is transferred to the providers through the provider agreement. You cannot successfully renegotiate an increase in your fee schedule individually because you have no collective bargaining leverage. And so, many providers have not had an increase in their fee schedule in the last 10 years. That's a decade. And many are unaware of the fact that you can negotiate your provider agreements. There is only one occupation I know of that haven't gotten a raise in a decade, and that is the private practice mental health providers. Another way that cost is transferred to you is by requiring excessive paperwork for some of the most basic and fundamental services that are essential to providing care, such as individual therapy, psychological testing, neuropsychological testing, and medications. Many of the services you provide on a daily basis are done at your expense without the opportunity of getting reimbursed, and that's simply unfair. Many psychologists are billing for 3 units of psychological testing when they are actually performing 5 units. They would rather take the 3 units without the fight than pay for the administrative costs of getting approved for what they are actually doing. And that's unfair. For each practice, you would have to hire someone full-time to supply, manage, and take care of all of the paperwork and manage all of the authorizations. The cost of hiring someone for that position is more than the income from providing the psychological and neuropsychological testing. And that does not make sense. It is incredibly unfair, and as a provider, it's hard for me to accept. The information obtained from quality psychological and neuropsychological assessments are invaluable and absolutely necessary for providing quality care. To maintain the quality of care, we simply pay for the assessments out of pocket. As the economy continues to unwind, the profits for individual practices continue to decline. Insurance companies are continuing to increase premiums, and families have less expendable income for mental health services. As a result, patients are simply not paying their bills. The cost of electronic practice management systems are prohibitive. All of the practice management systems simply increase your overall cost and does not enable you to deliver a higher quality of care. It would cost you a minimum of $7,000 to purchase and implement a practice management system. In addition, you would have to pay for training, software updates, and software repairs. And after all of this, you would still need a billing company. The typical billing company charges about 7 to 8%. The billing companies will successfully submit 90 to 95% of your claims correctly on the first pass. That means that's easy money. It doesn't make sense for them to spend extra resources to collect on the 5 to 10%, because it's easier to get 8% on 95% of your claims than to get 8% on the 5 to 10% of your claims, which they would have to pay for. If you choose to have your billing in-house, you pay for what you get. For one employee who understands what he or she is doing and is trustworthy and reliable, you will have to pay that person a minimum of $40,000 per year. The cost of that one employee is significantly more than 10 to 15% of what you would lose with going with the billing company. The entire system doesn't make sense, and no matter how you work the numbers, none of the scenarios actually work. The concept of an independent private practice is outdated. The main reason why you have not had an increase in your fee schedule is because there are too many providers. The supply is much greater than the demand, while the operating cost continues to increase each year. Recently, I searched an insurance company's website for psychiatrists, psychologists, LCSW, and LCPC within a 5-mile radius, and the results were surprising. There were a total of 986 providers within a 5-mile radius of my office, many operating independently. And finally, the insurance companies reduce your reimbursements by writing or amending to your agreements that they will not cover specific diagnosis or assessments. They justify their decision by stating that testing for conditions such as ADHD, oppositional defiant disorder, conduct disorder, psychotic disorders, anxiety disorders, and personality disorders are educational in nature. In addition, they simply refuse to cover specific assessments because they feel it is experimental. This is done unilaterally and without input from providers. The overall effect is that you simply will not be able to obtain objective information about any patient without you paying for it. In conclusion, providers across the country must find ways to protect their interests. The answer to these challenges is consolidation, because the cost, risk, and isolation of private practices makes it unpractical to profit in this environment. These individual kingdoms will need to consolidate to offer resistance to the unilateral business decisions by the insurance company executives. My idea is to form the nation's largest group without walls. This is an organization where each individual private practice operates securely and independently. The model is similar to Wikipedia and Facebook. This allows us to share tasks and responsibilities, to significantly reduce overhead, and allows us to respond to challenges as a group. So, imagine all of the possibilities. Run your entire practice with no middleman involved. Renegotiate your contract with 20,000 other providers. Significantly reduce your overhead and operating costs. Gain greater control over your practice. Start caring for yourself first. Start caring for your family second. And remember, none of this is worth it if the practice of medicine negatively impact you and your family's health and relationships. And oh, by the way, did I say that I plan to put this all together at no cost to you? So, for more information, please submit the contact form and we'll give you more detailed information about how this system works. Thank you. My name is Dr. Jody W. Reed. Bye.